Hello, my name is Dr. Reshma Mahtani. I am Chief of Breast Medical Oncology at Miami Cancer Institute, Baptist Health, South Florida. Guidelines recommend continuation of endocrine therapy for patients with ER-positive, hormone receptor-negative advanced breast cancer until a patient develops endocrine resistance, at which point chemotherapy is ultimately utilized. Investigations into pathways that mediate endocrine therapy resistance has led to the development of several targeted therapies. PI3 kinase AKT pathway alterations are found in greater than 50% of advanced breast cancer patients, and Capivasertib is a selective potent inhibitor of 3 isoforms of AKT. The phase 2 FACTION trial assessed the addition of Capivasertib to fulvestrant in patients with ER-positive, HER2-negative advanced breast cancer following relapse or progression on an aromatase inhibitor. What we heard at ASCO 2022 was updated progression-free survival and mature OS outcomes, safety and results, as well as a very important secondary analysis of outcomes according to pathway alteration status. With additional follow-up and 77% maturity for survival data, the difference in OS between the two arms widened and reached statistical significance. At the primary analysis, the benefit of Capivasertib did not appear to be influenced by PI3 AKT PTEN pathway alterations. However, during follow-up, the researchers expanded the biomarker profiling to include NGS testing, which enabled them to increase the number of genetic alterations they could investigate and more accurately determine the pathway alteration status. This enhanced analysis showed more patients had alterations than the original analysis, and the magnitude of benefits of PFS and OS were greater in this group. The median PFS was 12.8 months versus 4.6 months, and the median OS was 39.8 months versus 20 months. This study set the stage for the phase 3 Capitello 291 trial we heard about more recently at San Antonio, which interestingly showed a benefit in both the pathway altered as well as the non-altered population, although there were about 16% of patients whose alteration status was actually unknown. All of this will certainly require further investigation, but the good news is that we may have another targeted agent available soon for our patients with ER-positive, HER2-negative advanced breast cancer with a toxicity profile that at first glance appears a bit better than the agents we currently have available in this space.